Hi everyone. So today I want to talk about eye contact. So many therapists put a lot of emphasis with eye contact, on eye contact when it comes to children with autism. And I think what's important to realize is that yes, we do put emphasis on eye contact, but again, we want to look at the frequency of eye contact, right? So most of the time, when we look at young children, we a lot of times will judge if they have autism or not based on their eye contact. But again, children with autism do have eye contact, but what we want to look at is the frequency at which they show eye contact. Now, I think what's important to look at is why is eye contact so important to us? So in our society, I think eye contact represents attention, engagement, fondness, respect, right? There's a lot going on in the eye contact. But I think it's also really important for us to look at how children with autism process information so that we can understand why is it so challenging for them to make eye contact during a conversation. So the first thing about processing information for children with autism is that they process details, right? They'll look at details rather than looking at the whole picture of things. So when they're looking at your face and trying to maintain a conversation with you, what they're doing is actually looking at the details of your face. They're looking at the details of the eyes. If you're saying to make eye contact, they're looking at the movement of your eyes, the color of your eyes, your eyelashes, your eyebrows, where are your eyes moving. So then it's hard for them to process what's coming out of your mouth, really. And then the second thing that we need to look at in terms of how they process information is that a lot of them will only be able to process one channel of information, right? So it's either auditory or it's visual. A lot of times they can't combine both at the same time, and that becomes what we call sensory overload. There's just too much going on at the same time, and again, gives them a really hard time to process information. The third thing we need to think about is that there's a lot of nonverbal information that comes through with the eyes, and to children with autism, one of the main difficulties is exactly that social piece, that social communication is so difficult for them, right? So I think it's important for us to really realize how much is going on for them when we ask them to make eye contact during a conversation, so that we can be more realistic about our expectations. So I think what we need to ask ourselves is why the eye contact? Why is eye contact so important to us, right? And in truth, it's not the eye contact that's important, but it's really what it represents to us, which is making that human contact. So I think if we realize that having that human contact is what's important, then I don't think that we would be emphasizing so much importance on having them make that eye contact and sustaining it, because it's actually taking away from that human contact that they can create with us. So we don't want that to be done at the expense of what is truly important. So that's something that we need to keep in mind. I think also that we need to realize that when we talk to each other, we don't look in each other's eyes. That's not true. We look in each other's direction, but we don't look in each other's eyes. We look in each other's eyes in a conversation only when we want to create intimacy, right? Either if it's for a loving reason or anger, right? When you really want to get feelings across. That's when we connect in someone's eyes, right? It's a very intimate moment, right? And I challenge you to try that in a conversation. Just, talk to someone, and then for a minute there, think about it, become aware of looking in their eyes and see how things shift. For that 1 second, it's really hard to look into someone's eyes because of the intimacy that it creates. So when you ask a child with autism to look in your eyes, especially the fact that they're so concrete, they're literally looking in your eyeballs, right? So, and that's very, very intimidating, right? It's very intimidating, it's very overwhelming, and it's not something that we do, so it would be unrealistic for us to expect it from them as well. So it's not to say that we don't teach eye contact, but I think what's important is more to teach what we call whole body listening, right? So looking in a person's direction, making sure that they know that you're listening to them. We teach it as eyes in the group, body in the group, ears in the group. Just more of that body awareness that they're not over here, in the entire time, that sometimes they are checking in with you to show that they're engaged in the conversation and asking questions, and that their body is facing you also. So there's different ways to teach that communication, and it doesn't necessarily have to be done solely through the eyes. Another thing is that it's not that we don't want to teach eye contact at all, but what I'm saying to you is that there's different children and different levels of comfort, right? So some of them will be able to be taught to look in your eyes, not in your eyes, look in your direction, and that'll be okay with them. They'll learn through time how to process information, more readily. While you're talking, it becomes a little bit more comfortable for them. But then there's other children that's really impossible for them, and I think we need to respect that. It's something that we can keep in mind, but that we need to respect. So definitely exposing them to different ways of showing interest in a conversation is really important. And if that's through some kind of eye contact as well, that's okay. It's just a part of making conversation. But what I'm saying is not to make to spend so much time on that, so much time, so much emphasis, so much therapy hours on that eye contact. I think that's really a waste, because at the end of the day, what we want is that human communication and that human link. And if we can get that first, the eyes will or will not follow, and that's okay, because that's not what's really important there. On a personal note, when I work with children with autism, what I've found is that if I don't pay too much attention to the eye contact, most of them will look away. They'll look away when they are listening to what I'm saying to them. So when they actually ask me the question, they'll look in my eyes, they'll look in my direction. When I'm answering them, they will look away, right? Because they're processing just the words that I'm saying. So with that, for me, I think that's very important. And I think for the children that it is very challenging for them to process both at the same time, I think that as they get older, they can just tell whoever their audience is, I am listening. I might be looking away, but I'm listening, and it actually helps me communicate better, right? And I think we can all be comfortable with that. So I think it's about being more open-minded about what eye contact really represents and what it means. Don't forget that in other societies, actually, it's some societies it's disrespectful to look in someone's eyes when you talk to them. So it's really about what we've made it, how we perceive it, right? And I think that we can all agree that if what we truly want is that human connection with someone, then the eye contact is not that important, right? There are other ways to show that we're interested in a conversation, and if this is the way that they process, we don't want to create eye contact at the expense of the human contact. We don't want to lose the human contact. So I challenge you to have a conversation with someone, look straight in their eyes, see what that feels like. And then when you do speak to your child with autism and that you do want them to look in your direction, instead of saying, look in my eyes, use something else. Just say, look in my direction, look over here. I'll say, like, look at Miss Nancy, right? You want to do it that way rather than saying to them, look in my eyes. That's it for today, and I hope to see you again next week. Bye.